Good morning. I'm going to present my Power BI project, the topic being California Emergency Department Report of the year 2021. So, talking about the data, I got this data set the, from the California Healthcare Department, the official website. So, that is the Healthcare Access and Information, HCAI. So, this particular website, from this website, I got the Excel tables, and that included actually summaries of patients who were treated in the different emergency departments of the California hospitals, and the patients who were just visiting the hospitals, as well as who were visiting, meaning they will be returning the same day, as well as patients who were getting treated, who were getting admitted, that is staying in the hospital for a while. So both these categories of patients details were provided in that particular Excel table. And I'll just look at this table view. So I had different um, information about the patients, including the age group, the diagnosis, what all diseases they were diagnosed with, or the disposition, that is after getting discharged, where they were dispositioned to, then the gender of the patients, then the language, then the payer, that means what kind of insurance policies they were using, then the race group and the residence of the patients, like from where they were coming. So, I mean, which is their um, place of residence. So, these kind of information were provided in that particular Excel table. So, it was just one whole consolidated, one very huge, vast Excel table. So, I had to divide all these into different small tables, because so that I could get these connected. That would be easier for the Power BI analysis, the analysis done by Power BI desktop. So I had divided all these into different tables, and these were actually lying in different columns. Actually, all these were lying as columns. So I had to do the unpivoting operations, so that I could make it easier for Power BI desktop to do the analysis on these. Similarly, I did for all the different tables. I had done the similar way, and then this is just information about the different patients who visited and admitted and who died, for a span of 5 years, just to see how during that COVID time, how the differences have been over the 5 years in the patients getting treated in the hospitals. Then so this is actually ambulance diversion data. So this is just some extra information I wanted to add to this particular analysis related to ambulance diversion. So I'll actually get into detail while presenting the visual. I'll explain it at that time. Then so these are the different tables um, that I used for this particular report making. So as I said, all these were lying as one whole consolidated table. So I just divided these into different, and I did my transformations and data transformations and everything in Power Query Editor. Then the model view is also this way. So the models are all connected by many to one connections. The models are connected. I mean, sorry, the tables are connected in this particular model, has many to one relationships. Okay, so now coming to the home page. So this is the home page, and here I have page navigators, which will take me to the different pages which shows the analysis for this report. So I'll just move on to the first page, that is overview of facilities. So this particular page shows just an overview of the different facilities. What I mean by facilities is the same term usage that was used by that particular healthcare website. Facilities is meant, what it means is the hospitals. So it's just the overview of the different hospitals which were considered in this particular project. So actually the number of facilities, I have actually brought it down to 150. It was a very huge number. So, and since it was a very large data set, the table was really huge. It was creating problems in loading the loading in Power BI desktop, so I had to reduce the number of facilities to 150. So I'm just considering these 150 facilities for this particular analysis, and these were spanning over 51 counties in the state of California. I've also grouped them into 8 regions for further analysis. So these 51, these hospitals were all lying in 8 regions in California state. And this is just a field map which helps me to show the areas that were considered in this particular study. Then I have this bar chart here which shows me the different facilities or the hospitals which are divided based on their MSSA designation, that is the medical service study area designation. So actually these hospitals are divided into regions based on the population of that particular region. So urban means the population is very high, so there are about 90 hospitals out of 150. 90 are lying in urban areas, and then there are the rural areas include less populated places, and frontier is very least populated areas. So just shows the hospitals, the distribution of the hospitals over the different MSSA designations. Okay, then here there is a donut chart which shows the distribution of the hospitals based on the ED service level. ED is emergency department service level. So the different service levels are like basic, standby, and comprehensive. So actually these service levels, actually these emergency departments are divided on basic, standby, and comprehensive based on the different provisions or any rules they follow in that particular hospitals, like whether the doctor should be on call or doctors are on duty, or the kind of medication they are providing to the patients. So all these, based on these conditions, the emergency departments are categorized whether they are basic or standby or comprehensive. So based on that also, this is just a description of how the hospitals are divided in this particular study analysis, how the hospitals are divided, whether they are under basic or standby or comprehensive. So this donut chart shows that majority, about 83% of the hospitals are coming under the basic emergency service level compared to standby and comprehensive. So this is just about this particular page. Here I've used cards to show the different figures, and then I've also used few buttons here in order to navigate to the different pages. So now we are currently in this page, so I'll just move to the next page, that is patient diversity report. So in this particular report, I've just categorized or grouped the different patients based on few information that was available in the tables, like language, or whether which place they are residing in, or the race groups. So for these I've used pie charts, and for this the donut chart. So these also I created a slicer here just to categorize the patients based on the different regions. You can just see the difference in the patients in the different regions. Then here there is an area chart which compares the patients who are getting admitted and who are visiting the hospitals, and that is by age. So I have this grouping of age, and I just did a combination chart of area chart was combined for both the admitted and visited patients. These are the admitted patients, the blue one, and the orange one shows the visited patients. So we can see the number of patients who visited are more, and the age group is it's little different. That is, the patients who are getting admitted are more of in this particular age group, like above 50 to 80. The younger ones are not getting admitted, but they are visiting and leaving the same day. So that age group is high. And these two lines are the average lines of admitted and visited patients, which I did using the analytics option. So the analytics option, answers option, and this also shows how much of a percentage of the age groups are above the average line and below the average line. Then Next is a tree map which shows the average patients per region by expected payer source. So as I said in the beginning, there are different payer sources, like these are different policies for payment. Like Medical is one of the most commonly used according to this particular analysis. Medical, then there is Medicare, private coverage, other payers, self-pay. So here Medical seems to be taking the top spot. And this actually, what I've done is average patients per region. So I've just created a DAX so that I can find the, okay, I'll take another region. So I just want to find the, the values based on only that particular region. Okay, so even if I select only the country, the county, it doesn't change. It's the value is only for that particular region. So if I select Greater Bay Area also, even if whatever county I select, it doesn't change because the value is for that particular region. So here I have actually used a DAX. So average, this is the DAX I used here, average visited patients per region, average X, and selected value are the DAX functions I used for this. Whatever selected value, whatever region I'm selecting, the average value is filtered only for that. So that is about this page, that is the patient diversity report. Now I'll move to my, I'll just click this button, I'll move to my next page, that is ED patient statistics. So this is the whole, the most important details of this particular report. So here I have a few cards which I have included so that I can get the important statistical information. The figures, important figures can be visualized in these cards. We have the total visits, we have the total admit percentage I got from this, then the mortality percentage, how much of deaths are happening, then how many patients are leaving without being seen. So that is also an important figure to be noted, like if the hospital is so crowded that the patients will have to leave without being seen. So this is the figures showing that. And then against medical advice means that is also another data which needs to be analyzed by hospitals. Like against medical advice meaning the patients do not follow the doctor's advice and they leave without buying the medicine. So that is another information which the hospitals can look into, like why are the patients not buying the medicines prescribed by the doctors. So these are some important information which we can get from this particular data, and that I have shown through these cards. Then we have a matrix here which are showing the different facilities or the hospitals and the total patients in each hospital, the total died, how many have left without being seen. And here I have used a DAX so that I can, that is a rank X function, so that I can see the ranking by patients. So here there is a slicer where I can select the region. Then here I have two buttons, and these buttons are working based on the bookmarks that I have used. So I've actually created bookmarks. These two patients and deaths, I've created two bookmarks, and based on these I've created the buttons. So I've used the rank functions for each bookmark. That is, I have done two rank X functions. I'll just show that. So we have the facility ranking by deaths. That is facility ranking by deaths. That is to see the total ranking of which hospital has the most deaths. And this is the DAX function I've used, rank X, and here I've used has one value because I didn't want the total to show the number 1. So I used that particular DAX function also. And then I have the facility ranking by patients also. Here the similar way I have the patients ranking. So I'll just click on each. So I'm clicking on facility ranking by patients. Okay, so this was the same page. We can see that Kaiser Foundation Hospital in Fontana has the total patients, maximum number of patients, and looks like it has the most deaths also. And here I've done some conditional formatting also. Here we can see data bars, and here also we can see that the rows have been different colors have been shown. So as we can see, the color combination is such that red shows the maximum number of deaths, which is the danger color. So now moving to facility ranking by deaths, I'm just selecting that. So that is highlighting the page, the hospitals which have the most deaths. This is the column showing the rank. Okay, so now we have an information option bar here that gives you an information that is drill through a facility for detailed analysis. So this is actually a button which I had created. So just the information button, I am just hovering over so that I can see what information I want to know. Drill through a facility for detailed analysis. So I'm just drilling through one facility, say this one. So Kaiser Foundation Hospital, Fontana. Right click to drill through. So I'll just right click, drill through. So I have two drill through options actually. That is for I want more detailed analysis of that particular hospital. So first I'll go to diagnosis. So diagnosis, Kaiser Foundation Hospital, Fontana. That was the one we selected. This shows that the bar charts show, stacked bar charts show, stacked bar chart shows the total patients who are visiting and the patients who are admitted, and that is by diagnosis. So if you look at the first one, which has the most number of visited patients, the symptom, the diagnosis is symptom, signs, and ill-defined conditions. What it means is that the patient may have, actually they don't have any good defined conditions. That is, they may not have any symptoms, but they must be in contact with some other person who got affected. So this was in the year 2021, that was during the COVID time. So we know that a lot of patients, they just get in contact with the infected person. They may not have any symptoms, so they visited the hospitals. So that is showing the maximum number of visited patients, so the admitted ones are less for this diagnosis. So these are the different diagnoses. Here infectious shows more number of admitted patients compared to the other. The blue color shows the admitted patients. So for infectious and for respiratory and all, the patients are getting admitted more. So this is a different diagnosis we can see for each hospital. If you want to see what kind of diagnosis was the patients, what diseases the patients were diagnosed more in that particular hospital, you'll get more detailed information if you drill through that particular matrix. Then we have another drill through here. Right click to drill through, and then I'm clicking drill through ambulance diversion. So here, okay, so for this particular page, it says no ambulance diversion for selected facility. That's because in this particular hospital there was no case of ambulance diversion. So I'll just hover over this information symbol. So I'll just read that ambulance diversion is a common method for reducing crowdedness of emergency departments by diverting the ambulance transported patients to a neighboring hospital. In a multi-hospital system, the ambulance diversion of one hospital increases the neighboring hospital's congestion. So this should be carefully considered for minimizing patient tardiness in the entire multi-hospital system. Okay, I'll just tell you what it is. That ambulance diversion means in any particular hospital, if they don't have enough beds, that is, they are so crowded that they cannot accommodate more patients, so and the ambulance is bringing more patients to the hospital, so they ask the ambulance to divert to the neighboring hospital. So this actually gives us an indirect indication that that particular hospital has less facilities. They need more facilities, they need more beds, so that for that particular indication we are calculating ambulance diversion. So in this particular hospital, we know the number of patients are more, we saw, but there is no ambulance diversion in this particular hospital. So actually it is good because they can accommodate more patients. So here also I've just shown the the bed size and all are more, 499, and the patients coming is also more actually, but they don't have the case of ambulance diversion. So we'll just see another case where we have ambulance diversion. I'll just select another okay, I'll see this one maybe if there's an ambulance diversion. Okay, this has a few. Many of them may have. Okay, I'll take one more. Let's see. Okay, here this particular hospital, Kaiser Foundation Hospital in Orange County, Anaheim. Okay, this particular hospital has ambulance diversion cases that in every month that we can see there 2021. This is the these many hours of zero point 0.8 hours in a day the ambulance has been diverting. That means that much of delay has been happening for the patient's treatment. So this particular hospital has the bed size is less, so they require more beds to accommodate more number of patients. So that is the analysis that we can do in this. Now how this is created, so actually here I have done two steps, two DAX measures were used. So this particular DAX is just a text, no ambulance diversion. That is, I'm using it in places where we don't have, the value is 0, there are no data. So I've used this for that particular case. And this is the, okay, ambulance diversion. Okay, this is the DAX that is used to calculate the ambulance diversions in each case. Okay, so what I've done here is, for this particular visual, I'll just go to view and selection. Okay, this particular visual, I'm just hiding this visual. Just going to card. Okay, this is the card. Okay, there is a card here actually. So this card is actually now transparent because there is data in that particular matrix. So if there is no data, no ambulance diversion, that that text would be visible. So here, in order to do that, what I've done is, in the visualization of that card, so in that card, see here I have this field here, that is the text, no ambulance diversion text. So what I've done is, the call out value, I've gone to call out value, and then I have a color, under color, this is the conditional formatting. So I've selected format style, I've selected field value, changed it to field value, and which field should be based this on. So I based it on the particular color text that I had, that DAX that I had created. The DAX which says that you have to give red color. Oh, I didn't show the DAX, I'm sorry. So this is the color text. So this is the DAX that I had created for this particular visual. That is, color text is equal to, this is the code showing red color, and if not blank, then it will be transparent. 00 shows transparent. So if it is blank, then the text would show red color, no ambulance diversion. So if it's not blank, then it will be transparent. So when it becomes transparent, the matrix can be, that particular matrix can be seen. So that was what is done here in order to do this. So I'll just show the visual. Okay, so this was based on this particular those particular selection operations. So in whatever hospital we don't have data, we don't have this data, so we'll see that particular text, that is no ambulance diversion for the selected facility, in red color, and if we have data here, then that will be shown as transparent. So we will see only this. Okay, so that was about this page. So I have covered everything in this page. Now moving on to the next page. Okay, in this page, this is a patient disposition, to show that patient disposition, that is after the patients got discharged, where they were heading to. So for this I've used a chord plot, which is not among the 30 core visuals. I've downloaded it from the app source. So here I have a few slicers, which the slicer shows the different regions, and since it was a lot of data and it was looking clumsy on this particular visual, so I had to select only the top 3 facilities for each region. So for that, I just went to the filter and I got the top 3 facilities, and each facility would show like the patients from those particular hospitals, from those facilities, would go to which place. So here we can see majority of the patients are back home, that is routine, then a few of them to skilled nursing care, a few of them to residential care, a few maybe prisoners, so back to prison, critical access hospitals, a few of them against medical advice. So that there are different places that they're going to. So this each hospital, we can see the top three hospitals, like where the patients are heading to after the discharge. So this visual shows that. Moving to the last page, that is, I'm sorry, okay, this is the last page showing the yearly report of patients. So all this while whatever I had showed was only for the year 2021. This particular report just shows the total admitted patients, total visited patients, and the number of patients who died by year. So we can select the different region and county from the slicer, also drop down menu. Um, so here we can see, okay, for this particular region we can see that this is a combination chart which includes stacked column chart as well as line chart. So the stacked column chart shows the sum of admits and visits, that is the number of patients who were admitted and visited from 2017 to 2019. We can see a little bit of increase in the number of patients, but as COVID hits in 2020, the number of patients who are visiting the hospitals have reduced to a greater extent, because people have started staying back homes to reduce the number of infection rates. So by 2020 the number has gone down, but by 2021, with the increasing number of patients, people had to visit hospitals. Number of patients who got admitted also got increased, as well as the number of patients who visited the hospitals. Similarly, here we can see this is the trend showing the deaths over the years. So from 2017 to 2019 it was almost the same, pretty much the same, but by 2020 there is a drastic increase in the number of deaths, though the number of patients have reduced, and it is also increasing by 2021. So whatever region you take, everywhere it's almost the same case. The trend is almost the same. The deaths have increased really huge. The patients who have visited has come down in 2020 and then increased in 2021. So this is just a trend that was showing in over the years, a yearly report of patients in the different emergency departments of hospitals in the state of California. So that's the end of my project. So these are just the different pages. Oh, I am sorry, I have not mentioned about the tooltip. So I'll just go back to this page. So I have also included tooltips here. So I'll just hover over this total visits. I'll see the tooltip of patients visited by gender. We can get an idea of how much of female population or how much of male population have been coming to the hospitals. Similarly, for the case of total admits also, we have the differentiation of female and male. We can see more of male patients are getting admitted, whereas in the case of visited we have more of female patients who are visiting and going. And here also I have tooltips that are showing the difference in the patients, female and male patients. So if I hover over each hospital data, I can get the different female and male patients, for which I had created the tooltip. And for the drill through pages as well, I just had a tooltip. When I hover over the hospital name, I just get the address of which county they are in, which region they are in. So these are the different things that I've done in my project. So that's all. So that's about my Power BI project. Thank you.